Hi, I'm Dr. Christina Wu. I'm Associate Professor at Emory University Winship Cancer Institute. I am a GI medical oncologist. This is a recent case that I have of a 70-plus-year-old patient who presented with metastatic colorectal cancer, newly diagnosed, and she was not symptomatic. She did have a colon primary with liver metastases, at that time deemed to be unresectable. And so when she had her tumor tested, we did find that she lacked mismatch repair protein. And so we were very excited knowing that she had a deficient mismatch repair or MSI-High tumor. We did talk in depth at the time because the ASCO data showing the efficacy of pembrolizumab in the first line setting did provide survival benefit. And so we sat down and talked about offering her pembrolizumab versus chemotherapy. As we sat down and thought about it, I reviewed the chemotherapy toxicities that we were pretty confident she would have, and also of immunotherapy. Not that it didn't have side effects. There are definitely autoimmune side effects that we can look out for, but thinking that it would be better tolerated. And so she proceeded with pembrolizumab immunotherapy. She tolerated it very well for a few months, but she actually did have side effects, pancreatitis actually from her treatment. So we had to stop and offer steroids. Before we were thinking about moving on to the next line of therapy, we did get restaging scans, and due to the great response, she actually now had resectable disease, and I had her see our surgical oncologist for a liver resection as well as primary colon cancer resection. And remarkably, the pathology now shows that the liver lesions actually did not have cancer in them, and that her primary tumor has in fact decreased in size remarkably. And so as far as we know, she does not have cancer in her body at this moment, and we are starting surveillance. And so I think this was an exceptional responder from immunotherapy, and just to stress the fact that we don't want to miss a chance to offer our patients this treatment. Definitely based on the trial, not everyone is going to have this response, but I think this, looking at quality of life and toxicities, this is something we do not want to miss.